measure recently as a result of several doctors, thousands of doctors leaving the shores of the country to seek greener pasture elsewhere. Doctors moving to places like the US, the UK, Saudi Arabia, and so many others, leaving the few doctors left in the nation overworked and underpaid. So the burnout is real. Many doctors are stressed. They are not working under the best of conditions. And as medical practitioners, when they work for several hours, it affects their sense of judgment. At the end of the day, it is the patients who pay the ultimate price for it. So it is not just about the doctors. The patients as well are involved. For instance, the World Health Organization recommendation for doctor-to-patient ratio is 1 to 600. But what do we have here in Nigeria? 1 to 10,000. So the doctors are clearly overworked, and of course they are complaining of being underpaid and not well taken care of. Recently, on Monday, the National Association of Resident Doctors gave an ultimatum, a 10-day ultimatum, that they would embark on a nationwide strike if their demands are not met. And recently, in an unfortunate twist of events, a resident doctor at the Rivers State University Teaching Hospital actually collapsed and died after being on call for 72 hours, non-stop. The doctor was on call for 72 hours and he went to the call room to get some rest, and that was where he allegedly collapsed and died. Quite an unfortunate one right there. So it seems the strike is imminent. The National Association of Resident Doctors, they are determined to go on strike if their demands are not met. Several demands right there. They're talking about payment of 5 months arrears of the consolidated medical salary structure, that's the COMMES, and of course the medical residency training fund, which is not being paid by some states. I understand they're having issues with states like Kaduna and of course Oyo State, among other demands. Joining us on the conversation this morning is the national president of the National Association of Resident Doctors, Dr. Tokwe Oshundara. Good morning, Dr. Oshundara.
Good morning, sir. Thank you for having me.
Thank you so much for joining us. All right, Dr. Oshundara, so much has been said concerning the health sector in Nigeria. Of course, so many doctors have left the country. Now you are left with fewer doctors, fewer resident doctors manning the hospitals, the public hospitals in Nigeria. And according to you, these doctors are overworked and underpaid. And as a result of burnout, just recently you lost one of your members in Rivers State, at the Rivers State University Teaching Hospital, who actually died, unfortunately, as a result of being overworked. He was on call for 72 hours. Dr. Shundara, please, can you give us a clear picture of what is actually going on right now in your association and your engagement with the government?
All right. Let me start by saying that once again, we want to, send our condolences to the family, friends, colleagues of Dr. Rotifa Femi, who unfortunately died at Rivers State University Teaching Hospital. But preliminary investigations were initially sketchy, and that gave room for mis- and disinformation concerning the cause of death, the conditions that are surrounding his death when those information came out. We've launched an investigation to know exactly what the matter is, and contrary to what was initially given out by some people, and it is born out of emotions, and they felt that that could have been the cause of his death. But we later discovered that Dr. Femi Rotifa was nursing a minor ailment, malaria, and he was on drug. And as of that time, he was even supposed to go back home to see his parents, but unfortunately, there was an election going on in Rivers State. That's the local government election. So he was unable to go, but he was in constant communication with the family. And, because sometimes when you go to the hospital, you enjoy 24 hours light. So he felt that he could manage in the hospital call room, and he was in the hospital call room, but he was not on call.
Oh.
What was out there on social media, and some media houses has also published that he was on call, but he was not on call because he got permission, to leave the hospital environment and take care of himself. So it's a wake-up call for all doctors to be selfish. Take care of yourself first. Don't mind whatsoever is happening in the hospital. You are duty bound to be alive. The beauty of life is when you are alive. So if you are not alive, you cannot continue with this work. Work will continue if any of us goes to the great beyond. So I just want to clear the air about that. Once again, I want to send condolences to the family, friends, and the association, the Assembly of Doctors all across Nigeria.
Dr. Shindara, thank you so much for that clarification. So Dr. Rotifa was actually not overworked in this case. We sincerely appreciate that clarification. And all the same, we commiserate with you and your association for the loss of an enterprising, a young, very young, and of course enterprising medical doctor right there. Do accept our sincere condolences.
Thank you.
All right. And that been established now. There have been several incidents. And apart from these unfortunate incidents of Dr. Rotifa Femi, incidentally a namesake as well, thought and prayers with his family, the plight. Now, I need you this morning. You are a comrade. You are the leader, National Association of Resident Doctors. Dr. Oshundara, can you give us a picture of the challenge as at this morning? Nigerians are watching, many will still watch later, of a typical day of a Nigerian resident doctor.
All right. In fact, I want to appreciate you for bringing this question up. The work schedule for an average Nigerian doctor is, in fact, not compatible with life, if we are going to say the truth. One, this is as a result of acute, severe shortage of manpower, not even affecting doctors alone. Everybody has been crying, has been calling, and it's concerning. The Ministry of Health, who is our parent ministry, and several other stakeholders in healthcare system in Nigeria, they've seen that there is actually reduced staffing, reduced manpower in all our hospitals. You go to some hospitals, you only find one doctor on call. If you observe, you will discover that there are several things that are going on in some hospitals. If you do your research and investigation very well, you will go to call and you will see call duty roster that you will find just one doctor perpetually on call. So he's going to be working that work shift. He's just going to be there 24 hours, 72 hours. In fact, some, they will be on call, like people in surgery department, they will be on call for months without having a break. This thing is killing. They are the cause of the burnout you are seeing. And as I said, it is as a result of reduced workforce within the hospital. So for an average Nigerian doctor, that workload is too much. It is grueling, and it is affecting us mentally. It is not only affecting us mentally, it is affecting us psychologically. It is affecting us physically. Then it is now becoming, most of the time you get to hospitals, you see cases of assault. Sometimes the doctors are also human beings. So behind all the work coats we put on is an human being. And this human being, if you put too much pressure on them, they become cynical. They become so misanthropic and sadistic. And when you have a doctor that is becoming sadistic, there is a tendency for a patient who is also under emotional stress as a result of the ailment he's suffering from to react. Then the relatives now begin to throw tantrums, and all you now see is a case of assault. Cases of assault in our hospitals, they are becoming alarming. Almost every week, we experience one case of assault, and it is reported to us. So for an average Nigerian doctor, that workload needs to be reviewed. And we've called on government, we've called on relevant stakeholders to find a policy that protects doctors when they are on duty. But in Nigeria, there is no policy, no regulation that protect, that safeguard the excess workload. Very demanding. You go for surgery, sometimes you see people within the space of 6-7 hours, they do repeated surgeries. And each case of surgery can last maybe just for CS, if there is no complication and everything goes smoothly. You see some doctors who are so gifted, you can operate a woman, bring out the baby within the space of 30 minutes, and they close up. But for some other cases, they are there 8 hours. Sometimes when there are complications, they call other people to come and team up with them, and they spend the whole of the day operating on just one single patient. Other patients are still there, and they have to cancel the case.
All right.
So these are some of the things we experience. Even those who are not surgeons, who are medical doctors working in internal medicine, because there are several specialties in medicine. You go to accident and emergency, you begin to review cases. You are not out of that place in 24 hours. And there are several patients waiting for you on the ward. As you are leaving accident and emergency, you still have patients on the ward. Sometimes you have patients in the clinic. You'll be in the clinic, they'll come and call you, come back to A&E. There are patients waiting for you there. It's an emergency. Come and see them quickly. And there are no doctors to attend to them. It's just one doctor or two. Now look at the statistics you gave out. You said one doctor to 600. That is the WHO standard. But what you have in Nigeria is one doctor to about 10,000. So it's alarming.
All
and
right.
Something needs to be done.
All right, Dr. Shuda, I'll come back to you quickly. Let me quickly go to Comrade Fadansi here with us in the studio. Comrade, from your own perspective, from your own experience as a citizen, as a patient now, what has been your experience when it comes to healthcare? As a recipient of healthcare now, what has been your experience as a Nigerian?
That we still need appeal, because that's what I always say, because we are in a nation where citizens watch the political leadership freely go for medicals. That's radical in orientation and delivery. You understand? Look at the case of that young man. He was not on call, but where was supposed to be the safest place for a patient? Not to his parents. He was supposed to travel because of the election, but he was in a hospital environment where somebody who is probably not a doctor is supposed to feel safest. That's where he lost his life. He doesn't have to be on duty. He was in a hospital premises where he's supposed to be safest, of course, among his colleagues who are supposed to manage him. Absolutely. And he died of malaria. What type of drugs were being administered? Do you? So the idea of medicine in Nigeria, one, if the doctor prescribes, are you sure you are getting the quality of drug you are supposed to use? Is it not fake? Look at what NAFDAC does on a daily, saying all of these drugs are fake. Hey, don't take it, it's poison. So you want to treat someone, you get the right prescription and the drug that is being administered. I know of a bishop who lost a child to poor drug use in a university hospital, teaching hospital in Nigeria. So the decay is so bad that we have to look at it. I pity doctors. Like he was saying, 1 to 10,000.
Yeah, when it's supposed to be 1 to 600, according to
10,000. So that's the odd figure. The records of government might show 2.3 doctors to 10,000, but the reality is 1 to 10,000. Is that person is online? Is somebody in that line of duty? But you see, when we cannot question actions, there was an Asian president that the doctors felt, look, we are overwhelmed in treating you, maybe we'll take you for that. So he said, no, what have you been using for the citizens? Use it on me. If I die, I die. I can't have because of me. So you see, the minds of men determines the kind of delivery they get. Unfortunately, every day, those nations of the world who want to meet or go beyond the target of 16 doctors to 10,000 as recommended by the World Health Organization, who are going towards 36 to go to Cuba. Cuba has about 38 to 1 to 10,000. Do you get? So those are nations that look at their citizens and they will say, hey, Nigerian doctors, opportunity, come. They are the ones taking them out. When we are now, and some will be like, look at what now happened. That's where political leadership should have a rethink. COVID-19 made us all revelers. They couldn't go for medicals abroad. Everybody had to stay back here. we can't pray for COVID all the time, but maybe it brings in sense into some of these people. Now, I'm surprised with the statistics that Oyo State was part of it, because I recall that Oyo State gained a whole lot during COVID-19. The director wrote proposal to Governor Seyi Makinde, hello, sir, if we do it this way, we manage it this way, we may not have to lock down. If I don't know of other places, I know Oyo State did not lock down, and many people moved from Lagos because life was like nil. Yeah. And people did not die on the streets in Oyo State. Do you know what happened after that? I discovered. And I look, ask people, challenge people to bring you proposals of what can work. And when it does, let it be known. That person was just a director of maybe communicable disease and all that wrote a proposal that the governor followed, and it did not work against them. It worked for them because a lot of commerce moved to Oyo State then. So, you know what the governor did? He now made him commissioner for health, a director in the ministry. He was not a politician. At some point, we need that kind of mindset to solve our problems of the health and medical sector. When politicians will always go to India, to America, to England, to England and all the rest for medicals, whereas we see examples of nations where things work, who are looking for doctors everywhere. Doctors of other nations
absolutely.
to conscript so that they can meet the target of what is meant for their citizens. We need a rethink about it. It's unfortunate what the doctors, if you go in near a hospital, you'll know what it's like. They are overwhelmed. The doctor will just finish surgery on somebody, is working in a way, they are calling him another word that there is another patient.
Just like you said.
Quite unfortunate.
Unfortunate, that's the situation on ground presently.
Let me come back to you, Dr. Shundara. Now, your association, you've issued a 10-day ultimatum, which will expire next week, Wednesday. That's the 10th of September, if I'm correct. Now, some of the demands you've made in your communique, you're asking, for payment of medical residency training fund, and of course, 5 months arrears of commerce as a consolidated medical salary structure. But the thing is, Doctor, in that communique, where I discovered that not all states have defaulted. Some states have actually paid. You cited a state like Kaduna State. You have been issues with Kaduna State. You also have been issues with Oyo State. So the question is, Dr. Shundara, if you embark on a nationwide strike, don't you think that will affect the innocent citizens of those states who have not defaulted?
Well, the essence of whatsoever we are doing is because of the citizens themselves. Because an hungry doctor will not be able to concentrate effectively to treat an ailing citizen. So if the citizens are going to get quality health care, they need doctors who are well-trained, satisfied with their work to deliver quality health care. So a doctor that is not satisfied, who is grumbling, who is, emotionally downcasted, and he feels that government is not prioritizing his welfare, how do you expect the doctor to deliver quality health care? Let's be factual and let's face reality. The beauty of whatsoever we are doing is to deliver quality health care, and you see your patient do well. That's what doctors are meant to do. But in Nigeria, the reverse is the case. Yet we still continue to work under very strenuous conditions and unimproved or suboptimal welfare to doctors. Compare what an average Nigerian doctor is getting to what other people are getting who are doctors all over the country. And sometimes you see people saying, you get the highest amount of money, you get this, you get that. That's not true. Whatever you are getting is just like myself as a doctor comparing what I'm doing and I'm expecting government to pay me as high as what they are paying a pilot.
Dr. Shundara, sorry to cut in. I was actually still going to come to that. I was still going to ask you that specific question, because if your members are complaining of being underpaid, what actually are they getting? Okay, can you please give us a range? What's a junior resident? What's the starting salary of a junior resident and that of a senior registrar? Well,
it ranges between 200 and 400.
That's for a junior resident?
Yes.
Okay, how about a senior registrar?
Yes, it's around 400. The differences are not that much, maybe 50, 60, 70,000 naira differences.
All right.
All right.
Now, knowing fully well, and we sympathize with you this morning because I think I've shared it on this program before about a friend of mine who is a doctor, very passionate man, who said, Femi, I will have left this country if not because I feel he works with women, is a gynecologist and all of those things. I've seen first-hand issues happen and I feel I'm needed. If I leave now, the system will lose. At the end of the day, fortunately, he has left again. And he gave me, one of his schedule one weekend where he resumed 8 a.m. on a Friday and left 5 p.m. on a Monday.
In Nigeria?
At a federal institution in this state. Yeah, and I was wondering, doctor, because I was thinking to myself, what quality of work can that by, okay, Friday is fine, Saturday is fine. By Sunday, what quality of work can that man do? Talk less of 5 p.m. on a Monday. Now, I want to ask, if I can, probe further that if actually you are supposed to work for 8 hours normally for adventure, or let's say 2 days, and it's being extended to like 3 days, 4 days, who draws that schedule? Who draws that roster? Can't you do what you can do and leave? Or how can that work? How does that work? Let me ask you. Who extends
I'm going to answer this question. Then I want to address a question earlier asked. Now, the way it works is that you look at the numbers of doctors that are in your department. Sometimes, in some departments, there are no house officers. In some departments, there are no registrars. You have the ladder or the organogram has this, for the timetable or the work schedule. You have the house officers, the residents, who are also called the junior residents. Then you have the senior resident before you have the consultants. So sometimes in some departments, you can have just residents and senior residents and consultant. Or you can have just junior resident, no senior resident, and consultant. So if you are lucky enough, you have all the 4 tiers, the house officers, junior, senior, and the consultant. So depending on the number of doctors you now have, you now draw the roster, because what we do is that you cannot leave your patient uncared for. So if I operate on a patient and after operating, there is another person coming as an emergency, or there is another person I've been treating on the ward. So I'm duty bound. As long as that patient is still under my care, I cannot leave that patient because of litigation. So if anything happens to that patient while I'm away from work, the legal consequences will be too grievous for me. If you know that you cannot take care of them, leave them. But if you begin to tell patients to leave and you are not attending to them, the populace, they will come out, public will come out, doctors are now attending to us, this and that, then they smear our personality. Then, there is this public several manipulatory conspiracy against doctors, several things you just begin to see them on social media. And for that reason, we just decided that, okay, do what you can do. But in doing the little you can do, you still discover that the burden of care is still enormous. So you sometimes work, for instance, just like the case you mentioned, if you are on call, you'll be on call from, let's say on Monday, you start from 8 a.m. in the morning. You finish the normal duty by 4 p.m. You are not going home. You are resuming work immediately from 4. Because even before you leave the normal work schedule, they are already, the nurses and the orderlies, they are already bringing another patient and telling you, doctor, we have a patient here. I work as a radiologist in training. Now, when I'm on call, while doing a scan for a patient, they will bring another patient. Doctor, are you the one on call? I will say yes. So as you are finishing the normal work, the normal things you need to do during the normal work schedule, 8 to 4, the patient is already waiting at the door, waiting for you to attend to him. So 4 o'clock immediately, you have in fact, at some point, you don't even have time to eat. By the time you are even done with the work and you want to eat, the food is cold. You just go back to go and sleep like that because you are tired.
We have talked about the challenges, and many Nigerians want to say, oh, is this a reality? Although I've had experiences as well, and I think I've said it on the program with Daniel, that sometimes that's the reality. We take feedback from the street, And they tell you, if a doctor, you go to hospital to meet a doctor today, even Cambridge, and you are given a day to come back in 3 months, most unlikely you might not meet the same doctor because the same doctor might have left the system. Now, you have talked about the issues and your challenges. What are your proposals, to your employers? What are you saying? What do you want them to do? Are there creative ways? Because you can say, oh, government, do this, pay. Are you making proposals to them? What do you want them to do? And if action is not taken, what's your next line of action?
All right. Thank you once again. Several proposals has been communicated to government. They know all of these things. We've agitated for one replacement. But government has their own bureaucratic policies, processes. You have to go through establishment, you have to go through head of service, you have to go through this. So the process of employment, sometimes they give you some defense that appears to be logical, because at some point they discover that those who are saddled with this employment of doctors and other health workers, they manipulate the figures, and you begin to have issues. Let me give you an example. In Obafemi Awolowo University Teaching Hospital, just about a year or two ago, there was a massive employment into the system. And what happened thereafter? Because they said the process was not was shabbily done, there was illegitimacy with the process, they had to lay off all the workers, including the doctors. So, but we told them that, see, you can find a way to avoid all this bureaucratic bottleneck and allow doctors to seamlessly come back to the hospitals without having to go through all those processes. Just create an avenue for one-on-one replacement. As a doctor is leaving, it doesn't become another month before. In fact, sometimes it takes 6 months. It takes several years. Some hospitals are still waiting. They have doctors that they've called for interview, but because the government has not approved it, they are still on the waiting list. And in the process, they lose interest because another person is calling them to come and work. You see people in Saudi Arabia calling doctors to come and work. UK is requesting for their services. You see, even look at what the government even did with St. Kitts. You have doctors who are suffering there, but the government is providing another avenue for doctors in Nigeria to leave the shores of this country and go to St. Kitts.
All right, Dr. Shundara, because of time, I'd like to ask you this question. It's quite multifaceted, and I'd like you to try to answer them as much as you can. Number one, you talk about the challenges doctors are facing. But
sorry, it's St. Lucia rather, not St. Kitts, St. Lucia.
Yeah. All right, and the challenges you're facing. Now, let's look at some of the root causes of these challenges. Where is the disconnect coming from? We have Nigerian universities producing several medical graduates. So is it that we don't have sufficient doctors? Because number one, I know we have a lot of graduates, okay, who studied medicine. They are out there looking for jobs. So is it the bureaucracy that is affecting employment of doctors? That's number one. Number two, I asked a question earlier. Your association has threatened rather to go on strike, but some states have not defaulted in their commitment. So my question again is, how will it affect those innocent, citizens of those states when you go on a nationwide strike, when actually not all states have defaulted on the promises to the medical doctors? And finally, again, doctor, what actually can be done to improve the lot of doctors in Nigeria? Here's how I mean. Medicine is supposed to be something born out of passion, okay? When you go to study medicine, you should be able to give back to the society. And there was a time I was doing the research across almost all the countries in the world talking about medical education. Dr. Shundara, you will agree with me that Nigeria is one of the cheapest places to study medicine, okay? Nigeria offers quality medical education at very subsidized rates. So what can we do to retain our talent? Because they get the education cheap here and they run abroad to offer their services to those countries.
So let me start from the rear. Whatsoever is happening to Nigerian doctors is not peculiar to us alone. It is happening to virtually everybody. The same, in fact, what you pay as your school fees, this same cheap education that you are talking about, we still pay higher compared to what other people are paying. Lawyers go to the same medical, their law school, they go through, the various legal processes and all. But they don't pay as high as what the doctors pay.
I know medical students pay more, but compared to other nations, I mean, Nigeria is still very okay to study medicine. That's my point.
Yes, Nigeria is okay to study medicine, but what your input, even as a doctor, because the government is not paying, especially for those who work and who studied in state tertiary institution, the government is not paying for house rent, the government is not paying for your textbooks, the government is not paying for your exams. You still have to pay out of pocket for all of these things. Subsidy is not just only on maybe federal institution. Of course, when you compare it with what is being paid as tuition in places like US, of course, those places are high. But even in those places, compare their own salary with that of a Nigerian doctor. You still discover that it's very, very high, such that when they are done with their schooling, they have sufficient to pay back the system that has trained them. That is the case. But if that is the case, even if you go through the training, what you have is not even sufficient enough for you to pay for all the things you've paid out of pocket. So if you are going to look at the statistics, we have to, the comparative analysis has to be balanced. So it's not just that we should look at it that, okay, what they are paying as tuition in other places is far higher than what we are paying them. So, and you also mentioned the case of some state institutions who have been paying MRTF and who are up to date with their commerce salary scale. Of course, but what you should know is that an injury to one is an injury to all. So we are not going to leave out, other doctors who have not been attended to. We leave them in the code. What we do as an association is that we team up.
So
and
it's
we
more
fight
like
for
a solidarity strike. It's more like
exactly.
All right.
All right. We'll take your final take because of time. In 15 seconds, Dr. Oshundara, on behalf of the NARD, do you trust the government of the day, the government, various state government, and the government of President Bola Ahmed Tinubu to do the needful within time?
Well, we are still engaging them. We are talking with some stakeholders, and we want to trust that before the expiration of the 10 days, they will do the needful. And some other states institutions like Kaduna State, like Oyo State doctors are on strike even before with the declaration of this ultimatum. Kaduna State is also on strike. Benue State, they are still waiting for the MRTF 2025. Oyo State has never even paid MRTF at all to these doctors.
Since 2024?
Kaduna State too. Yes, they've not paid MRTF at all. And MRTF started as far back as 2022. Oyo State has not collected it at all for once.
All right. All right.
So please, I also want to say that the relevant stakeholders who are listening to us now, we do not want to go on strike. We trust the renewed hope agenda on earth of President Bola Ahmed Tinubu. And we trust that those who are saddled with the work of ensuring that things go smoothly in the health system, we attend to these concerns because they all know that these concerns exist and
yeah, Comrade, 10 seconds. Your final take on this matter. This is your country. This is my country.
It's our country. And I want to apologize on behalf of Nigerians to all doctors. I didn't know we were going to get to that when I was talking about the quality of life in some nations. From poorest of the poor that they pay to in Luxembourg, in Denmark, in all those places, is between $10 and $13 per hour. So if the normal call duty of a doctor from 8 to 4 p.m., and it says you don't even close at that time. So you are talking of about $80 per day. Poorest, is the minimum wage.
We have to go, yeah.
You are talking about, so to my mind, I think we should be sincere. It's unfortunate doctors are earning $200, $400. God will help us, and we pray Nigerian leadership will go along that line. So we don't pray for COVID again.
Yeah. All right, that's deep. Comrade Larry Father and Public Affairs Analyst, thank you for your time and your take. So it's a pleasure speaking with you. And of course, Dr. Tokpe Oshundara, the president of the National Association of Resident Doctors in Nigeria. We thank you for your time, and again, as a station, as a program on Spring, and personally, we commiserate with you on the loss of Dr. Femi, known as Femoski, at River State. All right.
Thank you very much, sir.
All right.
Yes, sir.
Thank you. And we close with that, of course. As they say, posterity will judge all. Let's do what is right. Femi Ojo is my name, and I'll see you tomorrow for the TGF edition of Morning Spring. The recap is on our YouTube channel at Western Spring Television, NG.
Daniel Emeka is my name. Join us again tomorrow for a fresh edition of Morning Spring. Do have a wonderful day. And most of all, take care of yourself, please. Health is wealth. Do have a wonderful day. Good morning.